Hello everyone, welcome to the Medic World Study with Dr. Mahi. Today we are going to discuss the previous year questions of anatomy from AIIMS 2019. So let's start with the first question. The region marked corresponds to the surface marking for which of the following structures? Let's see the image. Here in the image, the area which is marked corresponds to the right atrium. So the answer is option B, that is right atrium. Next question, the action of the muscle attached to the marked area. Let's see the image. Here in the image, the area which is marked by the question mark is the greater trochanter of the femur, and the muscle fibers attached here are the gluteus medius and minimus, and their function is to abduct the thigh, and their anterior fibers rotate the thigh medially. So the answer to this question is option C, that is abduction of the thigh. Now the next question, which of the following finger has two dorsal interossei muscle? We all know dorsal interossei is responsible for the abduction of fingers, and the finger which contains two dorsal interossei is the middle finger. So the answer to this question is option C, that is middle finger. The structure that divides the liver in Coinot's classification system is. The answer to this question is option A, that is portal vein. It divides the liver in Coinot's classification system. So the answer is option A. Now, next question. Which of the following muscle is not supplied by the structure marked A? Let's see the image. Here the image shows the oculomotor nerve, and it does not supply the superior oblique muscle because we all know the mnemonic, that is SO4. So superior oblique is supplied by the fourth cranial nerve, that is trochlear nerve. It is not supplied by the oculomotor nerve. So the answer to this question is option B, that is superior oblique muscle. Now the next question, the wrong statement regarding the levator ani muscle. Let's see the statements. It supports the pelvic viscera. It is the true statement. Next statement, converge downwards and medially. It is also the true statement. It consists of ileococcygeus and pubococcygeus. It is also the true statement. Now, the next option, attached to the pelvic brim. It is the false statement. So the answer is option D, that is attached to pelvic brim, because levator ani muscle is not attached to the pelvic brim. Now the next question. In the given section of the heart, match the marked structures A, B, C, and D. Let's see the image. Here, we have to identify the structures which are marked as A, B, C, and D. The structure which is marked as A, first of all, we have to identify left and right. Here, this segment is more muscular one, so it is the left one, and it is the right one which is less muscles. Now, let's identify the structures. The structure which is marked as A is the membranous part of interventricular septum. So, A is 5. Okay, let's see the options simultaneously. Here A is 5, so B and D is cancelled. Okay, now next option, B. Let's identify B. B is the right anterior papillary muscles. B is the papillary muscles, and we have identified it as a right side, so B is 3. We have figured out the answer, that is C. Let's confirm it by seeing the other options too. C is papillary muscles of left ventricle, 2, and D is muscle pectinate, that is 1. We have figured out the answer. Let's move towards the other question. A lesion of the structure marked in the image below causes. Let's see the image. Here in the image, the structure which is marked is the pyramid, which contains the pyramidal tracts, and the lesion of this pyramid leads to contralateral hemiplegia. So the answer to this question is option A, that is contralateral hemiplegia. Now next question. Identify the structure marked in the image. Here in the image, the structure which is marked here by the question mark is the ulnar artery. So the answer to this question is option B, that is ulnar artery. Let's move towards the other question. True regarding the lesion of the structure marked by the arrow is. Let's see the image. Here in the image, the structure which is marked is the radial nerve. Here it is the radial nerve in the cubital fossa, and the lesion of this nerve can lead to the wrist drop. So the answer to this question is option D, that is wrist drop. Now the next question, which of the following structures given below is related to the structure highlighted in the image? Here in the image, the structure which is highlighted is the ischial spine, and the structure which is related to it is the pudendal nerve. So the answer is option A, that is pudendal nerve. Now the next question, all of the following form the marked structure except, let's see the image. The image here shows the dorsal digital expansion of the middle finger, and the palmar interosseous do not attach to the middle finger, and therefore it does not contribute to the dorsal digital expansion of the middle finger. So the answer to this question is option D, that is second palmar interosseous. Now the next question, which of the following structures of the brachial plexus do not give branches? We all know that divisions of brachial plexus do not give any branches. So the answer to this question is option D, that is divisions. Now the next question, lesion of the structure marked A causes. Let's first of all identify the structure which is marked as A. Here the structure which is marked as A is the median nerve, and the lesion of this nerve causes the loss of sensation in the nail of the index finger. So the answer is option A. Now the next question, which of the following is related to the marked area in the image? In the image, it shows the image of the left kidney, and it is related to the stomach. So the answer is option A, that is stomach. Now the next question. The blood supply to the structure marked by the image marked in the image is by. First of all, we have to identify the structure which is marked in the image, and the structure here is the fornix, and the blood supply of fornix is anterior cerebral artery. So the answer to this question is option C, that is anterior cerebral artery. Next question, marked structure is derived from the. Let's see the image. The structure marked here is the membranous part of interventricular septum, and it is derived from the endocardial cushion. So the answer is option A, that is endocardial cushion. Now the next question. All of the following supply the marked structure except. We have to identify the marked structure. First of all, the structure which is marked here is the right ventricle, and it is not supplied by the diagonal artery. So the answer is option D, that is diagonal artery. Now the next question. What is the nerve supply of the structure marked in the image below? The structure here which is marked in the image is the superior oblique muscle, and it is innervated by the trochlear nerve. We have discussed the mnemonic SO4. Fourth nerve is the trochlear nerve. So the answer is option B, that is trochlear nerve. Now, thank you so much. We have completed the previous year questions of anatomy from AIIMS 2019. Thank you so much.